Welcome to Centered Presents The Future of Health. Join me, Christina Waleka, along with Dr. Molly Brown, as we dive deep into the world of brain-based wellness.
In each episode, we will explore cutting-edge insights and practical techniques that empower you to achieve optimal health and super high-energy living.
Tune in and start your journey toward a healthier, more vibrant you. Welcome to Centered Presents The Future of Health. And on today's episode, we are so lucky to be joined by Dr. John Turner, who is the inventor, developer, creator of the QNRT method, Quantum Neurological Reset Therapy.
Yeah, the QNRT technique and method has completely changed not only my own life, but yours probably too, right, Christina?
Yeah.
And with all of the thousands of people that I've worked on, it accelerates an amazing result in getting them to the state of health they want to be in.
I think we both kind of had that instant reaction with QNRT where we had no idea what we were setting ourselves up for. And all of a sudden, I know you were at a seminar and I learned QNRT through you, but you're like, this is what I've been missing in terms of everything we've practiced in our lives, from therapy to mental health state balancing the adrenals, balancing the nervous system. This was like the aha moment.
Yes, the QNRT is such an efficient technique that when I feel like when I found the QNRT and the result I experienced with it, I would have looked my entire life for this body of work. It encompasses emotional, nervous system reset, physical changes, physiological changes, neurological changes. It's a very comprehensive system that gives an incredible result in changing the state of your health.
Yeah. And I mean, again, talk therapy, whatever it may be, the great thing about QNRT is we allow you to come in and then we tell you kind of what it is your body's telling us, and we address that issue with us. So you're, again, not just going into appointment and not really knowing where to start or how to define what you're feeling or suffering from. Like, we do that work for you, which makes it easy and efficient and effective.
Yeah, the QNRT method picks up the priority stresses in the brain and body. So it unlocks basically wherever the body's shut down. And so it can really quickly lead to physical changes in digestive health, changes in sleep, changes in immune resilience or nervous system resilience. And it's just a technique that gives an efficient result for almost every health issue you could imagine.
And Dr. Turner, he'll mention it, but like suffered from his own problem, and that's how he discovered this work. But this is his life's work, and he's any chance I get to talk or listen to him or learn from him is a beyond valuable opportunity.
Yeah, it's an amazing body of work that we're really excited to get him on to hear about how the work developed, what sort of results he gets, the scope of the work, and how it works. So please help us in welcoming Dr. John Turner.
Dr. Turner, we are so excited to have you here today on Centered Presents The Future of Health. Obviously, Molly and I are huge advocates, supporters, believers in your work, so much so that we take as many opportunities as we can to continue learning and studying from you. If you wouldn't mind introducing yourself to our audience and just telling a little bit about yourself and your background.
Okay, yeah, my name is Dr. John Turner. I am a chiropractor, and I have a practice in Georgia, just north of Atlanta, called Roswell, Georgia. Been in practice quite a few years. Can't remember as many years as it's been, but it's been at least 30. I have seen a lot of different things, and the way that QNRT was developed, it's called Quantum Neurological Reset Therapy. And it was really developed out of need for myself. I had a life-threatening injury that sidelined me where I couldn't practice for about a year. And during that time, I also developed a serious health condition that was also life-threatening. And going through that stress and trauma for a little over a year, I realized that I needed help. My brain wasn't right. My body wasn't right. I saw a number of different physicians and alternative healthcare practitioners, and they all said, from our point of view, you seem to be good, except when you live inside your condition, you never feel good. And so for me, I realized that I was in a situation that for me to enjoy practicing again, which was a major part of my life and still is, that I realized I had to get myself well. I just didn't know how to. As I deal with a lot of clients who come in with these same type of chronic symptoms. So from there, I realized that I had to look into trying to find methods and ways that might relate to a way or a pathway that would allow me to get well. So through a lot of research, one of the things I kept finding in the research was that emotional trauma plays a major portion to someone's health. And for me, I felt that I had the excuses of injury and the health condition I was dealing with. And I thought for sure it wouldn't be related to an emotional stress. Well, how do you go through injuries? How do you go through life without accumulating a few? And I really came to the conclusion that that had to be dealt with. And so through the process of having that as what I thought my major problem was, then I started to look inward and try to find ways how I could get well. During that time, I was practicing, probably only maybe about 2 hours a day, only seeing a select number of clients. And they just watched me get better through that process. And they were so excited. They would ask, how do I get what you're doing? And my answer was, I don't know what I'm doing. I'm working with the nervous system. I'm working with the brain. And I haven't figured it out yet. But my clients were very persistent. And through that process, they also wanted to get treated that way. And so I started doing this. And this probably happened back in 2005 and 6. So the need was really out of a selfish reason. And the selfish reason was really for me to try to get well. In the process, I didn't really see that there was an avenue that this could also help others. And as it started to helping others, then I had practitioners as clients and they wanted to be trained. And so through the process of the number of years, we have a very thriving practice. We see people from all over United States, Canada, and even the world. They fly in to see us for chronic problems that don't seem to get better under traditional therapies or even alternative therapies. And through that, we've also teach classes for licensed practitioners where we train practitioners to do exactly what we do on our practice as well. So it really has changed my life and has changed other people's lives, as you guys know, who've been trained by me and you work with clients. And it is fascinating and rewarding to have clients say, nothing else has helped, but I can't believe this has. We're so grateful. And this is a common thing that happens in our office when we work with clients.
So when you were developing the method, you were focusing on balancing your nervous system before you were even going to start looking at the body work, and you saw that your body was kind of healing as you balanced the brain.
Yeah, for my standing, my focus was specifically the nervous system as it relates to spinal health, and just totally missed the whole concept that the whole brain is where everything starts, and then it kind of filters down through the spine and then goes out through the nerves. And we say that every tissue in your body has a nerve fiber that goes to it. So there's communication throughout your whole body from your brain coming down your spine and going out through the nerves. I just was stuck in one area of that concept and didn't really expand into the other area, which was the brain. And that's what we call the supercomputer.
It's interesting, your story of finding the QNRT for survival. I feel like that's almost everyone. That was my story too, with the chronic immune conditions and the nervous system. And I feel like the QNRT gives the nervous system reset that everybody talks about and everybody wants. Can you tell us how it does that, how it developed to do that?
Yeah, so the nervous system controls and coordinates everything. So as we said, every cell in your body has a nerve fiber going to it, and it's directly communicating at all times. So at that standpoint is that if we're not working with the nervous system, we're really not working with the health of the body. So for example, if you were to take some nutrition and take certain supplements, well, that has to be processed and assimilated within the digestive system, which is controlled by the nervous system. So if your digestive system isn't working properly, then you're not going to assimilate the food properly and you're not going to get the proper nutrition. So everything starts from that standpoint. And so for me, like when clients come in to be seen, one of the first things I say is, we cover their case history, and there's always, a myriad of either symptoms or struggles that they're having. And I have to let them know that before we get started, one of the things I'm going to do in this exam is to try to find out if I can find a brain imbalance, because that's all I can work on. If you don't have a brain imbalance and you're having this particular condition, then I'm not the provider for you. There's nothing I can offer you unless I can find something related to the nervous system. Well, I've been in practice for a number of years, and that's only happened twice.
Okay, I was going to ask.
So, everyone I do find, has a brain imbalance, and it's very specific. For example, you could have specific problems on your right side that would lead to certain digestive issues, anxiety, panic attacks, brain fog. And these are very specific for a right side brain imbalance. If you have a left sided brain imbalance, then we might be dealing with depression. We may be dealing with ADD type symptoms, inability to focus. Your memory is starting to go bad. And it's all related to how your brain works. And in the process of what we do, that's what we look for. We look to see if we can find a brain imbalance. I say this statement to our practitioners. As practitioners, we don't treat diseases. What we do is treat people with conditions. And so by treating the nervous system and treating the main factor of how everything is communicating, if we can balance that out, then what we hope to find and what we hope to see is that your system will start to self-regulate again and start to get well.
Yeah, and we know that inflammation obviously is one of the worst things for our body. But I think as a therapist too, what's super cool is you were able to attach brain lobes and body tissues to certain feelings. And when you walk into a therapist's office, like a lot of us don't have the vocabulary or aren't able to necessarily define what we're going through or how we're feeling. How were you able to attach those different emotions to the different parts of the body?
Yeah. So, you mentioned two things. You mentioned the mind, which is the emotional component, the feelings that we have. And we also have the brain, which is a filtering system. And so first we start with the filtering system first. The filtering system of our brain is mainly to filter 80 to 85% of those signals that we don't want to interpret. So our brain is basically set up so that we can basically have that filtering system in such a way that we can, not be triggered by certain situations in our life. The mind is where that emotion is. So if we've had a trauma, as you mentioned, and in that trauma, we developed anxiety, we developed fear, we developed anger, then that now becomes a triggering mechanism. And if our brain isn't working properly, it can't filter those emotions in such a way to self-regulate. So now here's a person that some maybe indiscriminate or not really a big issue occur, where all of a sudden they're anger and they're frustrated and they're in this state of emotional overload and they don't know why. And we're saying it comes from even deeper than that. It comes from what those emotional traumas stuck in our subconscious that goes into the brain. And depending on what brain areas is influenced, it's going to affect a specific tissue. Why? Because we talked about how every nerve cell or every tissue cell has a nerve fiber going to it, and specific parts of our brain control different parts of our body. So when we talk about survival brain, which is brainstem, the brainstem only controls the tissues from everything that goes in your mouth and goes through your body and then is eliminated, and anything from what we call the procreation part of our body that's controlled by the brainstem. So if that part of our brain is influenced or out of balance, then we may have digestive problems. We may have bloating. We may have heartburn. We may have different aspects of what can affect our digestive system. And it's all coming from the brainstem, which then relates to a stress or trauma that the client can't relate to, but we can as QNRT practitioners.
Yeah, I've had so many cases where the digestion as a child just shuts down, right? So the QNRT then frees up the nervous system and immediately the stomach stops hurting. And a lot of times, or sometimes it takes a little, takes repetitive resets, but it's just remarkable the results we get with the immune system and the digestion and in balancing the nervous system. And so how do you explain like the laser and the neurologically based points on the body? How do you explain that to people?
Right. Well, the reset is just really a very small portion of the visit. In fact, it's probably the briefest moment of a client's visit when they come into our office. What we're really interested in is initially evaluating the brain and finding out where the imbalances are. And then from there, we are then communicating with the body. And that's what a laser is used for, is a way of communicating with the body, identifying those neurological reflexes, and a way of basically kind of activating them. So we're bringing up files in the system. Remember, we said that the brain's like a supercomputer. Computer's really based on our brain. And so our brain has files, it has subcategories. And what the QNRT system does, the majority of the visit is identifying the brain lobe that is stressed for that particular moment, what tissue that may involve. Those brain lobes and tissues have reflex points that we can activate with a laser, and we are able to kind of lock that information in. So by the time we're ready to identify the emotional stress, what is so unusual for clients is, and you know this as a therapist, this is certainly not talk therapy. We really don't get into talking and getting to the problem. In other words, in talk therapy, we're talking through the problem, but the client has to identify what that problem is to be able to talk about it. And certainly in the therapy world, there are so many good aspects of training that you guys go through, which is, how to deal with this and what are the tools we can use. But the difference in QNRT, we're more interested in the neurological system and resetting that so that they can be more open to the ideas that you may suggest for ways to get through their stress and trauma. Once we identify the area of the body that we're working on, the significant difference of the quantum part of the reset therapy is that we identify everything about that stress, from the age of the person, from the type of stress they were dealing with the type of emotions they were dealing with that. And we do that just by reading the body. We consider the body like a keyboard, and all we have to do is punch in the right information and we get the right information back. So the quantum part of the reset is the discovery of what we have on that particular session. And so we explain to the client what we find, and then it's a matter of them kind of going back into their history and finding out what was going on. So far, with every reset I've done, I've never not had a client not identify the emotional stresses that we have found out. And from there, now we need to reset the nervous system, which means we need to reset the limbic brain, which is that early survival brain. That's where all those triggering mechanisms get locked in there. And so we have to activate different parts of the brain, what we call the hypothalamus, the amygdala, the hippocampus. These are all part of the limbic brain. And we do that by activating cranial nerves, because when you have an emotional trauma, you may remember a certain smell, which would be a cranial nerve olfactory. There may be a certain visual input, which would be certain cranial nerves that supply or comply with that. So when we treat an emotional stress, we're not going to talk through it. What we're going to do is try to reset the nervous system by using the means and methods that it already knows. It already knows that, when you're stressed, what happens? Your traps or your shoulders go up. Well, that's activating one of the cranial nerves. We already know that the stress may be your inability to talk about something. That's going to activate the throat and the tongue. So we're using all aspects in the reset, which is locked into the memory file that we discovered.
One thing I find really efficient about the QNRT system is that it picks up the priority stress. Is that right? So like the priority stress or trauma gets locked in at a certain age and to a certain organ or gland. Can you talk about that a little bit?
Yeah, the nervous system is really only going to allow us to work on what it's able to work on. In other words, we don't want to, a client may come in with some serious infraction or some serious abuse that may have occurred earlier in their life. But the nervous system does everything it does to suppress that. So it tries to suppress the memory, it tries to suppress everything about that. And it's not going to come up unless, you're ready to deal with it. So what happens is that, maybe we know that by doing the case history, but before we even get there, we may be dealing with other stresses and other triggers to try to allow the nervous system to calm and reconnect properly. So eventually we may get to that trauma. And it doesn't always happen first. Sometimes it does, but we have come to learn that whatever we're finding and working on, that's really kind of what the nervous system wants to work on.
Depending on what you're going through, a number of QNRT sessions, in the beginning, you instantly feel lighter and better. But again, life's happening. We keep being triggered. I will take a reset any chance I get because you become more resilient and you need less and less, but you can always find something to work through in your life.
That's true. I mean, we're all human beings and we're all instilled with emotions. And emotions aren't bad. It's just that, can we self-regulate them? One of the things we say about a proper health is there's two things that are evident when I'm looking at a client. Is the first thing that is evident, are they able to self-heal? Because our bodies are designed for self-healing. It's a constant process. It's just the beauty of how this was all put together. And we basically say the way God has done this is such a miraculous design that we can self-heal in most instances if we have the proper and functioning nervous system. We can also self-regulate. Self-regulating means that we don't have to think about, what we ate for our morning meal. It's already going through the process and assimilating. So a self-regulation process is not only from a physical standpoint, but also from a mental and emotional standpoint. If we get triggered easily and we're now acting in anger in such a way, that's not a self-regulating process. And so for those two things to happen, we have to have a proper functioning nervous system. And so if that's restored, guess what also is restored? Our ability to self-heal and our ability to self-regulate. I mean, one of the things as you noticed, and I have noticed, when clients get treated and through a process of treatment, you said so many times, well, they feel better. But if you identify it even further, they say, I feel calmer. I don't seem to feel on edge as often. These things don't bother me as much. And, one of the nice things I like to hear from my clients is that other people notice that they're different. In other words, the client themselves may not notice a lot of change just yet, but they'll say, my wife, my husband have noticed a great change in my ability to deal with the stresses in my life.
Yeah. I feel like one of the first things we notice through the QNRT work is that people's eyes become brighter and their skin becomes brighter, and they have a happy look on their face. And so that's a really good explanation of the QNRT. The goal of the QNRT is to treat the nervous system, and it does that amazingly. And once that nervous system is resilient, then people begin to self-heal.
Yeah, that's it. That's the key. It can self-heal and can self-regulate.
Yeah, and so the technique delivers the nervous system reset.
Yes, because we're resetting a number of things. We're resetting how the nervous system communicates, and that's through the limbic system. We're resetting what's called the cerebellum, which is all sensory information comes through the cerebellum, and it determines if you're safe or not. And so throughout the whole process is that there's so many things that are going on in your brain and your nervous system on a regular basis. You're not even aware of it. And it's through the system that we developed, we tap into that. That's why we can identify stresses in a person's brain and body maybe 30 years earlier. And it's still creating a problem now from a health standpoint, from a self-regulating standpoint, from an emotional standpoint, from a relationship standpoint. It's all part of that filtering system. We don't get rid of necessarily the memory of the trauma. We get rid of the charge or the emotional aspect that is that mind aspect that's a result of the nervous system or the brain being out of balance.
Right. I love how you say that. I also love how you say we can't treat the body from the neck down, right? Like we have to treat it from the brain.
It's impossible. Yeah, I mean, because the brain is from the neck up, but the brain then goes to everything from below the neck. So you can't chop them one way or the other. I mean, for example, like if someone has a cardiovascular issue, well, that's affecting a system of the body. But what controls and coordinates that cardiovascular system? It's got to be the brain, right? And so, I mean, they both will match. I mean, if we have a client that has a cardiovascular condition and they need to see a cardiologist, we're all for that. You know, we want other treatment. What other treatment can be done? We just want to coordinate. We want to be a part of it. We want to be a part of that balancing aspect of it. And so we work with a number of clients that see other healthcare professionals, but we provide something else for them that they may not get from that professional that will enhance what they're also doing.
I feel what the QNRT offers, I feel like it connects the dots for everything everyone's done, right? Because it's the one thing that brings in the brain-based focus. So it connects the dots if people have done a lot of supplementation or a lot of IVs or a lot of body work, a lot of chiropractic work, right?
Yeah, you know, I usually ask this question when I do seminars or I do webinars or even, you know, talks. I usually ask the people that I'm speaking to, what is your number one thing that you think you need to do to be healthy? And inevitably, it comes down to three things. The first one everyone says is exercise. And they all feel guilty because they're not doing enough. The second is they all think they should eat better. They should eat more healthier foods. And so, and then the third one is it invariably comes down to that they should sleep better or get more sleep. And it's not that those three things are not true, but by themselves, they're not enough. The top thing needs to be, what's your brain health like? How are you self-regulating? How are you able to self-heal? You know, are you balanced in a perspective? Are there stresses in your life that are basically creating effects in your ability to express yourself at the maximum level, right? So it is so important that it really becomes the number one thing. If our brain is healthy, we're going to get more out of exercise. If our brain is healthy, we're going to assimilate our foods better and get better nutrition. If our brain is healthy, we're obviously going to sleep better. But that's what clients come in. Usually when I see an imbalance, I know clients aren't sleeping well. I know they're probably waking up multiple times during the night. And we say that your brain is just not designed to deal with long-term stress. The way it was made and the way it was designed, that we need to deal with stress immediately, try to resolve the issue quickly, and then from there move on. And if we don't do that, that's what leads to these traumas and these brain imbalances that then eventually lead to potentially physical symptoms or physical diagnoses.
Would you mind elaborating more on that with the physical diagnosis or the symptoms? And it's not necessarily, again, your body shutting down. We can talk about the common cold, a virus, the underlying toxins, because those are the different colored lasers as well that I'm sure people are interested in learning about.
Sure. I mean, you know, you're mentioning the immune system. So if your immune system breaks down, you're certainly going to be more prone to maybe have an infection, a virus, or, you know, even a parasite to some level and degree. If your digestive system doesn't have the right enzymes, then normally those type of infections are eliminated within the stomach. But if you're under stress, then your stomach acid is going to be lower and you'll be more prone to these type of infections. So it goes back to the fact that, well, what's causing the immune dysfunction? It's evident, right? It's a self-regulating, self-healing system. Is that if we're under stress, and this is what the research keeps saying. This was the problem that I had when I did all the research. Everyone talked about the emotional stability and the emotional balance and how the brain is the number one factor for health. But when it came down to the solution was either in a pill or in a bottle or in a lotion. And I just had a hard time saying, well, why don't we stick with the brain? Why don't we go and stick where the brain, if that's the source, why don't we stay there? And that's was my big aha moment. Was it didn't seem like there's a lot of different aspects of health where that's the focus. And so for me, that became my major focus for my own self to get well. And then has certainly become my driving force in working with clients, the same thing. So yes, we may deal with the immune system. We may deal with some level of infection they may be dealing with, but we're really not treating the infection. What we're treating is the body's ability to recover from that.
Yeah, that's a really great way to say it. We're treating the nervous system in the brain so that everything starts functioning.
Starts functioning properly. And you know what? If we need help, if a client maybe has been under a level of stress that they don't have the time, nor do they have the ability to self-heal because their system is so worn down, then I'm happy to use traditional medicine and have that be a part of the treatment if the client needs it. So as a practitioner, yes, we have to recognize that in QNRT, it works so well, but at the same standpoint, we also have to recognize when a client may need something else.
I have never found anything like QNRT, and also the combination of QNRT and neurofeedback that gives the result of resetting the nervous system and resetting the brain. We get incredible results with the autoimmune body of work. It's remarkable even that a large viral reset, you can reset almost overnight.
Yes, that we do other ancillary services as well. And so the ancillary service that you mentioned is a traditional therapy that's been used since the 1960s and has been well researched, and it's called neurofeedback and biofeedback. And it's a way that I look at, it's a way of what I call, it's brain exercise or brain gym, in a way that we can actually target different areas of the brain to actually help resolve some of the stresses in the brain. And so QNRT is a way of resetting the nervous system, and the neurofeedback, biofeedback is a way of strengthening the nervous system. So we use those in combination. By itself, I mean, from the standpoint, for example, neurofeedback, as a traditional therapy, they'll say many times it will take 50 to 100 sessions of neurofeedback and biofeedback to really get a change. We see from a clinical standpoint that is greatly reduced by working with the brain and doing the QNRT resets. We see that our clients don't need as many of those repeat therapies to make that change.
Yeah, we hear about that often. Again, you hear about people doing neurofeedback, and it's the combination of the two that really advances the process. And you do have to heal what the brain has suffered from as you get your brain waves functioning the way that they should.
Yeah, and the nice thing about for example, we use the neurofeedback as a gold standard. So, in the initial visit, that's part of our initial visit, is that we're actually evaluating the brain and the different brain waves that are part of the brain, because we can see from the patterns of those numbers in the brain waves, we can see long-term trauma is evident in the brain. We can see short-term trauma. We can see if you're not sleeping properly, we can target that area of the brain where you're not sleeping. We can see different patterns for anxiety, ADD and ADHD, depression, impulsiveness. So it really becomes a gold standard for us to get a general look at the brain without actually going inside the brain. It's what we call a functional exam. We're functionally testing the brain and the nervous system, and we're looking at the patterns that have been developed and researched for well over 60 to 70 years. And having that research, we can then talk to our clients about those things that we found that are contributing potentially to their health problem or their mental stress problems. And so that when we do the work that we're doing through QNRT, we will also see the brainwave patterns improve as well. And so we want to see evidence that what we're doing is making a change.
And that is data and straight evidence. Like you can't disregard what's being shown on the EEG, especially pre-work and post-work. Are there any cases that stand out to you that you wouldn't mind sharing?
There's so many.
I know.
So many, yeah.
So I just thought you probably would ask that question. So I thought, well, why don't I just take last week?
Okay. Yeah, that sounds good.
That's about the best I can remember because we have so many. So I'll just take last week, and these are what people told me as far as the ones we've been treating. Some of those cases, we have gotten to the end of treatment and they are dismissed. And some of these cases are in the mix of it. But, like one of the cases, we had a client that I was treating their teenager, and they just went through a very nasty divorce. Teenagers about 13 or 14 years old, really struggling. I mean, really struggling with their identity, really struggling with their social interactions at school, and rightfully so, because her world has just turned upside down. And so the mother brought her daughter in, And we were probably like 6 or 8 therapies at this point within treatment. And the mother was just so appreciative, telling us that she has her daughter back. She's laughing again. She's interacting with her mother. She's becoming more socially integrated within school. And she really was self-isolating as a way of not knowing how to actually deal with that problem. And so we're not even through the full treatment that we recommended. And the mother's already saying, can I please give a testimonial? But we're too busy in our practice to take time like this and do testimonials. But that was one thing I was kind of shocked by. She was so excited about how well her daughter's doing. The other case would be a 32-year-old female that we just actually discharged from treatment, because what we started with, that she had double trauma markers, short-term, long-term. She was very anxious and very panicky, and she is just a new mom. So she has a 1-year-old, and this started after she had her baby. What was happening is that she now transitioned from being a wife to a mother. And a lot of her trauma was growing up in her family. And so she had a lot of abuse in her family. And so it just brought all that up, and she didn't know how to deal with it. And so we found in her case that her right brain was certainly out of balance, severely out of balance. And we just provide a treatment plan to basically balance out her brain, work on those stress traumas, deal with the QNRT resets. We did neurofeedback training. And I think about 14 sessions in, over a period of about 2.5, 3 months, she sat there and brought her mother with her. First time I met her mother. And she said, I brought my mother because I want my mother to hear how well I'm doing. And I want my mother to sign up as a client.
The ultimate compliment.
The ultimate compliment. The other is, the other one I was thinking of is that I'm treating, I'm very early in this case, but I'm treating a 62-year-old female that has intense anger. She's been angry all her life. She says, I go to bed angry and I wake up angry. She's angry at everything. She's angry at politics. She's angry at her current life situation. She's certainly in a very dysfunctional self-regulating process. We found her brain to be out of balance. We started working on it. About 4 or 5 visits in, she was like, oh my gosh. She says, I woke up not angry. She says, I'm starting to realize that there's a person inside of me that has something to offer. You know, she's not in this state of anger, and whatever's happening in the world's not bothering her as much. And we're only 6 visits in, and we're just really starting to deal with the trauma in her life. And so it is a process. I mean, you know, you may get symptomatic relief, but the aspect, we're looking for long-term relief. And so we're happy that she's feeling better, but we know it's a process as well. And I think one of the last cases is that we just heard this week, we're dealing with a 16-year-old boy that was failing his grades in school, not getting any A's, not even close. He was getting D's, failing out of classes. And the mom was very concerned. Also, this child was very addicted to video games and playing video games at all times. Well, we saw in the EEG, we saw that it was evident that his brain was showing very sluggish, and that's what a lot of video gaming will do. And so we basically applied treatment, which involved a lot of the neurofeedback. We also did some QNRT. We also did other balancing techniques that we do in our practice. And we're only 2 months in, and the mother told me this week that her son got 4 A's. 4 A's in her classes. And we have a deal. I create a deal with my teenagers, is that we have a deal. If he can do 4 A's, get 4 A's in different classes, that he'll be allowed to bring video games back in a very monitored and a very time segment of his life. But it's amazing now that he's actually doing it, and he will be able to get some of that back in his life as long as he maintains his grades. And these are just 4 cases. So, and these are just this week. And so, you know, we get so used to people telling us how much better they're doing. And, you know, it's rare that we don't get progress. There are cases that, you know, sometimes don't respond the way you want. And it takes longer, but it's all about the process of, as we talked about in this podcast, is what can we do to basically help balance out the brain, which will create the brain to self-regulate and self-heal. And the client can express themselves at such a level in the way they were created and designed.
A remarkable thing for me is that when we go to the seminars, it's not just you or one other person having those results. It's like the whole body of practitioners that are well trained are having reproducible results where they're like creating joy in their clinic and positive health, and all the ramifications that go out from that in the families, the kids, the parents. And it's just such an amazing and brilliant body of work. I'm so grateful. I'm always so grateful. Christina and I are so grateful every day that we have this work to help other people and help them feel better and to really live the life that, like you said, they're designed to live.
Well, thank you for that input. I mean, it just really makes my heart feel good knowing that I can't treat everybody in the world. I need other practitioners to do what I do. And you guys certainly have come to the classes and have learned what, things that are necessary. And we're always learning. At this point, I'm working on the next seminar that I'm going to be giving because there's always things to learn about the human body. And when we get close enough, there's one more thing to do. But it is satisfying, at least at this point, that a lot of the cases that come in, that if we can find the answers and we can find that there are certain imbalances that we can diagnose and treat, and then we see the evidence, and we are an evidence-based type of practice. One of the things that always kind of bother me about wellness is, and typically, even today, people come in and say, well, I'm told that it's always this. I have heavy metals that I have to detox. I have parasites that I have to get rid of. My adrenals are not working properly. It's pretty much the standard in the wellness care. And they come in with a bag of supplements that they're taking over 20 to 30 things. And that's just evidence to me that what's not happening is that their brain and nervous system hasn't been treated because they can't self-regulate. And so, in the wellness world, we come up with this ideas that we have to, detox from toxins in our body. I'm not saying that's not important. And we have to exercise more, we have to work out more, but even all those things won't be able to cause the shift in your nervous system that we try to do on a regular basis. And then once we do that, yes, we can talk about, some of the things, but I've been there where I'm dealing with, maybe you have yeast and candida problems, or you have parasites, or you need to detox. I've been at that level, but I'm so glad that's not my first thing I have to offer anymore.
I just love to, again, like you see the results over and over again, like reproducible results, and you're really changing people's lives. And again, you can't help everybody, but you start with one person in a family and their relationships get better, the family dynamic gets better, and it's just so fun to see people thriving and relationships thriving, and it's so cool.
It's true. I think one of our largest resources of referrals is that when we work with a client, they're bringing someone else in from the family to get treated,
it's
like
the best
the
compliment.
case we talked about with their mother, or all of a sudden the husband's coming in, and I usually ask, why are you here? And they're like, I'm not sure, but my wife says I need it. And I've noticed the changes. And so, we always say when we're dealing with somebody in a relationship, it's money well spent, because the person that's going to benefit is not only going to be the person who we're treating, but also the spouse or the partner in their life that are part of that relationship.
For my own self, you're my go-to, if anything. You've gotten me through so many, big life events that I don't know that I necessarily could have recovered from. So thank you so much.
You're welcome.
And Dr. Turner, I have so many colleagues that when they get the result that they're aiming for, they want to know more about the work and how to get trained. Can you tell us how to find your trainings, your clinic, and your online resources?
Yeah, so you can, if you're interested in training, you can go onto QNRT.com. And on there, we have posted practitioners that we have trained all over the world, so that if you're looking for a practitioner in your area, you can look online for that. If you're also interested in training, we have our training series set up, I think for this year, where we're doing several basic level trainings to be certified. And then we have several advanced seminars that you can come to, but you have to be certified first. And then if you're wanting more information about me, you can go to my website, which is just drjohnturner.com, drjohnturner.com. And on there, you'll find research, you'll find information that may be helpful to understand what QNRT is, testimonials, and things about myself and my staff and everything that we do at our practice.
Well, Dr. Turner, it's such a privilege and pleasure to get to spend time with you as always. And thank you so much for taking the time.
You're welcome. Yeah, it's a pleasure.
Yeah, thank you so much. We're very excited to be able to capture your wisdom.
And continue sharing the information so hopefully more and more people know it's out there.
All right, sounds good. Thank you.
Thank you for joining us on today's episode of Centered Presents The Future of Health. If you're interested in learning more, please visit us at drmollybrown.com or email us at media@drmollybrown.com.